Hello, my name is Keith, and this is part of a series of videos about healthy living. If you like these videos, I ask you to subscribe on our YouTube channel. This particular video was created during the Mayor's Fitness Challenge, where communities competed against each other to be deemed the most fit city. And then before the following year, the team would then get together and meet and discuss the accomplishments and any potential changes for the coming year. This one describes the accomplishments of the past and the discussion on how the challenge will be managed for 2022. Uh, Angelica Keene will lead the first part, and I will discuss the details of the challenge in the second part.
All right, welcome everyone to the 2022 Health First Mayor's Fitness Challenge orientation. I have the privilege, my name is Angelica Keene and I work with the University of Florida. I have the privilege to present to you guys today on kind of what we've accomplished, what was a little bit of history on this initiative, and potentially some brainstorming ideas about how to move forward. So this is the presentation, Making the Change Healthy Community. So if we could, next slide, please. So 6 years ago, a group of like-minded individuals, community members, companies, all kind of came together to create this Get Healthy Brevard kind of committee. The idea behind this committee was to make Brevard the healthiest county in Florida. And we did this through this idea of collaboration and a multi-pronged approach. And so out of this specific committee was born one of these initiatives that we work on, and that is the Health First Mayor's Fitness Challenge. So next slide, please. So before we kind of dive into all the accomplishments, we have to first define what is a healthy community, because that was our original goal. If our goal is to make Brevard County the healthiest county, we have to look at more than just the residents individually. And so I wanted to explain. So according to the World Health Organization, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Meaning that we're moving away from this idea, like I talked about, of individual health being the only component. The idea is that people need to be healthy where they live, work, eat, and play. And so, and that you can kind of see on this graph of like, what is a healthy community? You can see there's a variety of aspects that do make up or influence an individual's person's health, which in turn defines how healthy a community is or how healthy a community has the opportunity to grow. There are some very specific kind of prerequisites that highlight around this that are kind of key components. And what's nice is the Health First Mayor's Fitness Challenge, we touch on some of those, but we have the opportunity to grow in other areas too, which is an amazing place to be. So some key kind of prerequisites to think about is that we need to think of individuals: peace, shelter, education, food, income, social economics, and substantial resources. So again, we're looking at what we're promoting. Do people have access to healthy foods? Do people have access to physical activity? And how do we get that there? So let's dive in. Next slide, please. So last year we surveyed the mayors specifically, which is a new thing we've done. This is the first year we tried that. And we did that kind of on two specific concepts and ideas. The first was this physical environment. So what is kind of being done or could be done around promoting this healthy behavior, the fitness component, nutrition, things like that. And what we found was some really great results. You guys are doing some amazing things. So what you'll see is over 70% of you, we sent it to all 12 mayors that participated. To clarify, we had 7 responses. So out of those responses, what we found is that 70% of you have said you guys have made improvements to pedestrians, either by lighting or reducing speeds. That is a fantastic start and moving in that direction. We also asked about healthy foods, and over 50% of you said that either yes, you had done it, or were in the process of doing. We didn't define what in the process was, so it could just be simply brainstorming too. But the idea is that these broader, deeper conversations are happening. 28% of you said you're working to either have or working to increase green space and park access. And that ties directly into all of our, hopefully, the initiatives and healthy walks and programs and fitness and person activities that we can hopefully, fingers crossed, bring back this year if things start to improve. And then over 50% of you guys said that you had made improvements on building sidewalks, walking trails, or even that connective resource, which brings that holistic approach together. Do people have access to where they live, work, eat, and play? So next slide, please.
There we go.
Yeah. So in addition to the physical environment, we asked about healthy policies or behaviors. So these are the idea behind these questions. We're looking at what happens in your in work environment, what happens in your organization, what happens in kind of the culture around, because not only do we want individuals to be healthy, but we want them to be healthy all year. So if we start thinking about health as this broader cultural thing, it'll just start to be an easier adaptation and much easier for people to maintain all year long. And what we found by asking these questions is, again, we took the yeses and the in progress. So there is some work to be done, of course, but the idea is that this concept of decreasing consumption of sugary sweetened beverages and or promoting water, over 40% of you guys said that yes, you already do this or that you're in the process. So another option we looked at was offering healthy foods at meetings or other meetings. And that's the one we think about. We don't think about a lot as a community, but as a culture, how many of we have parties, we always have cake. Maybe there's some opportunity to have some fruits and vegetables and things to incorporate. Not taking away your cake, because Lord knows I love it too. But what else can we add? And that was awesome to see that over 50% of you guys have either started trying to think about that or in the process of. Okay. 30% of you guys said that you provide prompts for physical activity near stairwells. And I can tell you that one works, because when I walk to the elevator and I see a little quick reminder to take the stairs, or somebody getting on the elevator says, oh, I guess I'll take the stairs today, I take the stairs every time. It's just that cultural norm of expectations. So 30% of you guys said you were already doing this type of thing. 20% of you said that you guys allow for walking meetings. Now, walking meetings in this Zoom environment is a great way, because it's something that we couldn't necessarily always do before. But one of the things that's a best practice that we educated participants on that I'd like people to think about is, instead of just sitting at your desk or participating via Zoom by sitting, go ahead and put those headphones in and take a walk around the block, especially if you just need to listen to the information or even maybe brainstorm and discuss. So 20% of you guys said that you were either already do that or in the process of doing that. And finally, we had over 70% of you said that you discourage sedentary behaviors, such as watching TV on breaks or sitting for long times, which means at the very least, people are getting up and moving away from their desk. There was a research study done recently, and what they found is that, unfortunately, inactivity, meaning lack of physical activity, costs the United States $117 billion in healthcare costs alone. And this is causality to other side effects, such as aches, pains, injuries, all sorts of things that could have all been prevented by this physical activity that we're kind of discussing and promoting through this Health First Mayor's Fitness Challenge. Now, it's not just all about the community. We have to look at what are the individuals doing as well. So next slide, please. So I wanted you guys to kind of think about this from the perspective of, like, yes, we've talked about the environmental factors and cues and things do make a difference. But as you can see from this graph, 30% of a person's health is still tied around their individual choices. So it has to go hand in hand. We have to be making these communities healthier, but they also got to do it. So let's see if they did. Next slide, please. So in addition to tracking their significant number of minutes that they put in and how many participants, what we found in our participant survey was that 84% increased the amount of time spent physically active. As you can see, it kind of goes from there. Things like number of days spent, consumptions of fruits and vegetables. 66% felt less stressed. 71% said they felt stronger. 79% had better mood. And actually, an interesting fact is that I think those percentages probably would have been higher. However, in the survey, I only asked, yes, you increased, or no, you didn't, or yes, you felt better, or no, you didn't. And I had a huge number of write-ins. We had over 550 people complete the survey, which is great response for this kind of data. And majority of the people that said no followed it up with a comment to say, we didn't increase, we maintained. And that is what we actually after, because that sustainability, that consistency is what actually makes someone healthy. Yes, it's great to get up and be active for a few weeks, but if you go right back to those unfortunate sedentary behaviors or bad eating, then it's just kind of that yo-yoing component that we don't want, that can in itself cause health concerns. So I will be editing that for next year. So we should hopefully see an increase with people saying that, yes, they're doing it, or yes, they're maintaining it, which is awesome, because that's how we get to our end goal of being the healthiest community in Brevard. Next slide, please. So where do we go from here? So the idea of that, I've shared all this data for you, and now it's like, okay, great. What do I do with that? And so we look at that from two perspectives, just like we had individually and as a community. So individually is continuing those healthy behaviors and modeling those behaviors, keeping in mind that most diets do not work. We've all had, or at least I know someone that has done a crazy crash diet, lost a bunch of weight, and then gained it all back, or has something. But the thing with diets, and the reason they don't work, is because they have that punishment, reward, restriction issues. So one way to think about it is, instead of thinking what you have to take away, but what you need to add. And so by kind of keeping to this concept of this my plate eating, it's like this idea of making half your plate fruits and vegetables, getting in whole grains, having protein and dairy if you like it, or if you're not lactose intolerant. Totally, if you are, there are lots of other ways to get in the vitamins and nutrients and minerals that come from those foods. But the idea of having this broad variety of food is the best way to find balance. And then, of course, continuing that physical activities. For kids, it's 60 minutes a day. And for adults, it's at least 150 to 300 minutes of exercise. I don't remember what our total average minutes of exercise was, but what was nice is that the participants that completed this challenge did report being in that window of range. I don't remember the exact number, but they all fell within that range, which is what we do want to see. And it is happening. So that's fantastic. So we just want to keep that up. Another trick to kind of keeping that nutrition and consistency is eating a good breakfast. Now, breakfast doesn't necessarily have to be a specific time frame, but it's kind of diving into that. First meal should be substantial, should be multiple avenues of the plate. That doesn't mean if you wake up at 6 a.m. that you have breakfast right at 6:30. There is some variance of time of capability for people depending on your hunger level and your food. The idea is that what you're putting in your body, that first meal, is a healthy choice. I know coffee and donuts are fantastic, but shouldn't be something we eat every day. Anything. And then the last idea for doing individually is this concept of mindfulness. And what that just means is paying attention to what you eat and how much you eat. I know I'm guilty of sitting in front of the TV with a bag of chips and they're gone, no matter what size it is, because I wasn't aware of what I was eating. So this is what we can do individually. So that's one part. What can we do as a community? Next slide, please. So as a community, we want to continue what we've been doing and potentially even expand upon that. So committing. We want you guys to commit to, again, to be part of the Health First Mayor's Fitness Challenge program, reaching out to leadership within your team. And also, in addition to that, to commit to this concept of creating these healthier policy, systems, and environmental changes. We have the leadership team of Health First Mayor's Fitness Challenge has a lot of resources. I know I'm always available to do trainings or best practices or look at things, but I know our team, a leadership team, has a plethora of expertise in a variety of different areas, in addition to just promoting this Health First Fitness Challenge. But step one is we want you to continue to commit to this challenge. Okay. Step two is assess. So once you we've already done that for you by providing the data of like kind of where everything looks and where you are, but kind of look at your community. Do you have maybe a specific need or area that you can accomplish? Next is plan. And that's, yes, plan your challenge, how you're going to get everybody up, involved, contributing. But again, looking at these broader systemic changes or opportunities, is there one that's a low-hanging fruit that you can incorporate? Implementation, let's put it into action. Whenever we plan, we want to take that action step. And that's where you have that constant feedback from the Health First Mayor's Fitness Challenge leadership team, but also from your own community team and your own community. There's a lot of expertise within Brevard County that's just waiting to be used. And finally, evaluations. And evaluations is something that the leadership team is going to continue to do. So what we ask for you there is that you guys help share it out, help promote. So when I send the surveys at the end, encourage your team to take it. We did get a good response, but we had over 2,000 people participate and only 550 people complete the survey. Now, it is a good start, but it would be awesome to get that information from everybody, because then we realistically know what we need to change, what we need to add, and what we can contribute and bring to you guys. So we're bringing that best program to be that goal of the healthiest community in the state of Florida. So next slide, please. So the last is just, here's my contact information. So if you've got any questions about what I've covered or data, or it sparks an idea, or you just want to brainstorm, this is how you reach out to me.
All right, so here we go. We're going to start into the new year. This is basically the schedule we're looking at. August 26th being today, the Lunch and Learn. October, November, we'll be recruiting sponsors. December, early December to January 14th, there's a registration for the t-shirts and the Great Weight Off. And then a couple weeks before the kickoff, we do the Great Weight Off weigh-ins. Then we have the kickoff on January 29th, the challenge from the 29th through the 26th. It works out on the calendar this year that we can actually get the whole 8 weeks in. So I was really happy about that. March 14th to the 26th, basically the last couple of weeks of the challenge would be the next Great Weight Off weigh-in for the end of the challenge. And then April 9th being the awards ceremony. So that's our schedule so far. Shirts, we're still in discussion about the shirts. There's been a lot of comments on the surveys about changing the shirt colors per team. On the other hand, I get the probably equal amount of comments of people saying they appreciate having the same team color for their community. So that's a constant dialogue. It continues to be something to discuss, the team identification versus rotating the colors. So we haven't figured that completely out yet, but we'll continue to work on that. Maybe more surveys with each of you would be helpful. We did look at dry fit, but dry fit is too much for our budget. We will maybe look at a blend to see if that is within the amount that we have to spend. But cotton tends to be the cheapest way to go. So that's what we've been doing. We looked at hats, towels, etc. But then it brought us back to shirts being the best use for our sponsors. So, because it's more difficult to show the sponsorships on smaller items. So, I think that pretty well is decided that we need to stick with the shirts. type. We're looking at maybe at long sleeve. I've done 5Ks in the past where they provided long sleeve shirts, and I thought that was nice. So we'll look at the cost of that as well. And then, of course, the logo will be the logo provided by the Fitness Challenge. We talked about taking the date off the logo, but then for the same reason that basically for the sake of our sponsorships, we want to have the year to year. Otherwise, someone will get a shirt that doesn't have the date on it, and they'll just keep the same shirt. So we want to make sure that we make sure we provide the opportunity for sponsors to advertise who they are and what they do. And of course, we'll change the phrase. Usually we'll have Karen Partridge here and marketing at Health First figure out what the next phrase would be. That's something we started a couple years ago. I thought that was a nice addition, having a nice, neat little new phrase each year. There was a question in the chat about V-necks. That's a good idea. I will write that down as something we should look at doing. I don't see that as being something that's going to be an extra cost. We will send the slides out and the recording. I'll do that afterwards. I'll send everything out to not just you all, but all the team leads and the mayors and et cetera. For the sake of transparency, we also want to share what our budget is. Health First provides annually $15,000 to help with this, and we usually get about $2,000 in sponsorships. About 10,000 of that 15,000 goes into the cost of shirts, $1,000 for the Great Weight Off Awards, $600 for signs, $500 for food and refreshments, about $1,000 for entertainment, $2,000 for paid media, $800 for the weekly prizes, about $650 to pay for the award ceremony, and about $200 for the tree ceremony. So, it's pretty close to, a very tight budget that so that we don't have funds left over. It all goes out to support this. Also see in the chat, we always end up with shirts left over in some of our municipalities. My recommendation in the past, so that we can continue to support the community, is when you have shirts left over that aren't picked up at the end of the challenge, what I've recommended is going ahead and identifying a school and providing those shirts to a school. Sponsors, these have been our traditional sponsors. We're always looking for more, but Health First, as you know, we have in-kind sponsors. Those are individuals on our leadership team who are putting a lot of time and energy into making sure this works. I left one very important sponsor out. I'll get to that in a second. But the health department is there. Brevard Tobacco Initiative has continued to provide $500 each year. Clear Channel provides us the billboard that we put up with the pictures. Eckerd Connects always helps out with 500. Last year, Lockheed Martin jumped on board with 500. Running Zone has always been a big in-kind supporter, as well as the extension service, as you can tell on this Lunch and Learn. And then United Launch Alliance last year jumped on with another $500 sponsorship. The one I left off that I kind of think is important is United Way. We also put a lot of time and energy into this as well. Thank you, Robin. I will talk to you about that. We will try to recruit additional sponsors so we can continue to grow this. Sponsor logos go on shirts, signs, our Facebook page. I've figured out how to rotate the top post of the Facebook page on the Mayor's Fitness Challenge site so that, hey, Gina did jump on. Okay, great. Whoops, I didn't mean to jump forward yet. Sorry. All right. Figured out how to move particular sponsors up to the top post on the Facebook page. So we're doing that. And then, of course, the Facebook groups, and also making sure we mention our sponsors at all of our events and ceremonies. Do appreciate our sponsors. Okay, moving forward to this coming year. Oh, great. Thank you, Deborah Foley. With Brevard Public Schools, they would agree to take the leftover t-shirts. All right, so new. I don't know why it took me 6 years to figure this out, but this is, I think, going to make everybody happy. Instead of having the weekly minutes sent out because the large number of emails that we have, sometimes those emails get lost or don't get through your servers, or they end up going to spam, and it's been a continual issue and headache for me as well as you. Since we're doing this on Google Docs, we can post these at stationary locations on the United Way website, municipal websites, the Facebook page, and then therefore the weekly email would just be a reminder to post your minutes at those sites. So all you would have to do is go to the same location every week and just post your minutes. Be a lot easier for all of you as well as us, and we would make sure that way we can make sure everyone has the opportunity to post their minutes. Second, points will continue. As you know, in the past, we've tried different ways to provide extra bonus points. Finally, ultimately decided the best way to run this program is to base it on the average minutes of exercise per team. So the size of a municipality doesn't matter. And also at the midpoint and at the end, extra bonus points for participation rates. We felt like that was important to continue to add that, because you should be awarded for maintaining the participation of your registrants. Third thing, depending on where we are with the COVID pandemic, we may need to plan for individual exercise versus planned community activities. I'll talk about that in a minute. New, we would like to implement video walks with our mayors and also with local celebrities. So we'll try to identify, VIPs in the community who can share with us what they're doing as far as exercise. And I think that would be a nice addition to the weekly information we provide. Continue random weekly gift card drawings for participants. That has been very well accepted, and we'll continue to do that. In the past, we provided not only gift cards, but we would provide, instead of gift cards, coupons to local restaurants and things like, or local activity centers and things like that, bowling alleys, stuff like that. But we're at this point in time, we are still wanting to try to avoid sending people to places where there's a lot of people. So we're just going to keep doing the gift card drawings. Continue the Facebook groups for each municipal team. I was very happy and pleased at how many people did participate in that. And it's a great way for us to provide more information to you and, add information about not only exercise or activities, but also nutrition information, health access information, those kinds of things. And we'll continue what we started last year with the second optional teams for the weekly survey for agencies and corporations. So besides just, you would have to sign up for a municipality as your team, but you would also have the opportunity to sign up for a particular agency or corporation. If your corporation wants to compete against each other, we can put that option for you. Or if your agency wants to compete against each other, you can do that as well. Continue weekly virtual health education classes. We did that last year. Even though we didn't get a lot of participation on those calls, we did share that on Facebook, and we did get a lot of hits on Facebook for those sessions. Is it possible to get the name of the top participant each week to each city's leader? Yeah, that's possible. I have additional support with Extra Vistas that I could assign them that task, and they can help me with that. Continuing on, targeted messaging for corporations, agencies, and municipalities. So if you have a corporate team or an agency team, working together or doing something separate to increase the health in your targeted community, we need to figure out a way to provide messaging for you as well. Weekly targeted walks designed for vulnerable communities. That has more to do with our goal at United Way is to try to reach out to the low income and vulnerable individuals, not just our goal at United Way, but others as well. And so we wanted to be a little bit more specific about how we want to do that and where we want to set up these types of activities. Now, if we can't actually have physical walks, maybe we can do something virtual where we discuss just those types of situations. And finally, increase use of surveys to share and receive information. Angelica has agreed to be our survey person as we move forward. So appreciate the information that she's already provided and will provide. And then going back to the discussion about the Delta variant, some of our events as we move forward may end up being virtual. So we want you to avoid indoor gatherings, wear masks, practice social distancing, exercise outdoors or in your own homes as much as possible. Like others on this call would probably also be able to share with you, I'm hearing more and more this time around about people that I know being affected by the Delta variant than even before before the variant was the issue. Just a list of our team that we have moving forward. Shout out to Melissa and Shauna Price, Melissa Breckenridge and Shauna Price from Health First being our primary sponsors. But we do have some new vistas that are going to help us out. Byron Cisneros, who's on this call. Thank you, Byron. Tammy Shelley, who is also continuing to work with us, but she saw the need in the local schools, so she's helping out with that as well. And Maggie, always been a supporter from the beginning. Angelica, of course, big supporter. Michelle, being our representative on the base. Karen, who helps with us with communications here at United Way. Kia and Anita, who are working with the Department of Health, who help us manage this program as well. And then Kaylin, who was an education vista, who we're moving over to health. So our health vistas are not only helping with the Mayor's Fitness Challenge, but they'll help with our Run United program and access to healthcare grant that we'll be having soon to provide healthcare navigators. So got a good team of people, and I might be leaving some people out. It's not intentional. We could use all the help that we can get.